Good evening and welcome to Aspen Ideas Health. I'm Dr. Celine Gounder. I'm an editor-at-large for public health at KFF and also a CBS News medical contributor. We're going to be talking about gun violence in America and some solutions that may not require legislation or regulation to reduce gun violence in this country. We have three amazing panelists with us this evening. Megan Rainey, who's an emergency physician and the incoming dean of the Yale School of Public Health. She is also the senior strategic advisor to a firm at the Aspen Institute, which focuses on ending gun violence through a nonpartisan public health approach. She's a fellow of the Aspen Institute's Health Innovators Fellowship and a member of the Aspen Global Leadership Network. Franklin Cozy Gay is director of the Violence Recovery Program at the University of Chicago Medicine, and he is focused on effective school-based, family-based, and hospital-based interventions that are across multiple sectors and multiple social and ecological levels. His work goes beyond looking at risk factors. He's really looking at the root causes of violence, including many of the social determinants of health. And last but not least, Michael Sodini is the founder of Walk the Talk America, a nonprofit organization dedicated to making positive change with respect to mental health and firearm awareness. Sodini is a third-generation firearm industry professional with over 20 years of experience who has imported and cultivated multiple successful firearm brands in the United States. So Franklin, I'd like to start with you. How did you get interested in public health and gun violence?
Yeah, no, thank you. And just it's an honor to share this panel with you, and thank you all for having me. So I am from the south side of Chicago, which is a great migration community. And what do I mean by a great migration community? This is a community that my grandparents landed in because they were escaping racial terrorism from the South. And so with that being said, that is part of the story that I want to share. You know, like, unfortunately, communities that have been impacted by violence are disproportionately African-American communities. We know that approximately 80% of the victims of gun violence are African-American men. We know that the method of violence is through guns, right? And so with that being said, what was important for me and what attracted me to public health is that it made me think about how we're approaching the solutions. And I want to, like, maybe if I can, really quickly, in the 50s, there was a group of lobbyists that actually said, you know what, it's not blank doesn't kill people, people kill people. Can anyone fill in the blank for me, what that blank is? Guns, that's what I hear, right? It actually wasn't. It was motor vehicles don't kill people, people kill people. Why does that resonate with me? Because public health approach looks beyond the individual, and it actually goes beyond to think about what role is our social environment or our ecology playing in terms of things that might place us at risk or actually protect us from a social problem or disease. And so that's what attracted me, was actually, you know what, it's not about the community that I was raised in being stigmatized. It's not about bad individuals making poor choices. It's not about poor peer relationships at the relational level, guys being involved with gangs. It's not simply about families not monitoring their children, knowing where they are, or parenting practices, or community practices in terms of how we come together to reinforce norms that we have for our community, which is described as informal social control. It's actually everything combined. And what attracts me currently in the conversation we've been having for the past 10 years is around emerging public health, which is actually saying, let's actually go upstream and look further at some of the root causes. Those root causes are directly tied to some of the things that brought how cities responded to that great migration in terms of how did they deal with the influx of African Americans coming into northern spaces. And so I hope to talk a little bit about that, but that's what attracted me to public health.
Now, Michael, you were initially interested in preventing mass shootings, but then you shifted your focus to suicide prevention. Could you share a little bit of that story?
Yeah, so originally my idea, because I'm third generation firearms industry expert, I got my job through nepotism. I would totally recommend that for a starting job. Okay, but the way I looked at it is the hot topic, right, was mass shootings. So I came up with an idea that, at the time, it wasn't realistic, but I was like, what if I could raise money from the gun industry and give it to the mental health community and fund the things that they talked about, the cutbacks financially that may have contributed to this problem? The outreach, I wanted to fund the outreach. And it wasn't until I started getting on the phone with people I had no business getting in contact with. Like if you guys all decided you wanted to play basketball tomorrow, you wouldn't call Michael Jordan and say, I need some help with free throws, right? And I was lucky enough through contacting people that worked in epidemiology and that were on the forefront of suicide prevention, and they were all telling me to focus on suicide prevention. Like, they were like, I know you want to stop this, but you really need to put your focus here, because here's where you could really make a dent. And at first, it didn't make sense to me. I was like, explain to me, because I want to work on suicide prevention, but I want to stop the next mass shooter. And it was Dr. Jeffrey Swanson down in North Carolina. This guy gave me 2 hours, right? It was great. He also gave me a bunch of homework assignments before he let me talk to him. But he was telling me, he's like, Mike, you could give 10 people that have bipolar disorder a handgun, and they will go the rest of their life without hurting themselves or anybody else. You can't predict future violence. There's no such thing as the movie Minority Report. They're like, focus on suicide prevention, work to get upstream and prevent the unpredictable, cast such a wide net, and maybe you catch that mass shooter in that net years before he does or she does something that's horrific. So that's how I got started.
Megan, why is legislation not enough to stop gun violence?
Celine, you always give me the easy questions. There are a wide variety of reasons that legislation is not enough. So within the world of public health, we talk about there being 4 steps to stopping a public health problem, which, as Franklin has described, firearm injury is. The health effects of firearm injury are tremendously real. As Mike alluded to, the spectrum of firearm injury and deaths are also wider than many of us know. Firearm suicide is the leading cause of firearm death, while firearm homicide is the leading cause of death for young Black men and boys. When you think about stopping any public health problem, we use 4 steps to address it. The first is that we measure it. We say, how common is it and who does it affect? The second is we look at what are the risk and protective factors, exactly what you were alluding to. How do we identify who's at risk and kind of change that? The third is we develop interventions, and the last is we scale up what works. In those interventions, legislation is one of them, and it is a major part of any public health solution. Look at car crashes, to use the example that you made. We put speed limits in place, we have drunk driving laws, we have licensing rules, so legislation is part of the solution. But it is never enough for a public health problem. The causes of any public health or health problem are always multifactorial, and the solutions have to be also. For the car crash example, we also put seatbelts in cars and airbags and changed the engineering of roads. We taught people about drunk driving. We have spent so much time and effort with media campaigns around drunk driving and changing the way that drinking and driving is portrayed in the movies. And we've also used education. If any of you have children or have grandchildren and have recently left a hospital with a newborn, you know you're not going to leave that hospital without that kid being in a car seat and making sure it's safely installed in your car, right? That is not legislation, that's practice on the parts of hospitals. Similarly, for firearm injury, 2 parts. One is we do live in a country where the Second Amendment is part of the Constitution. 40% of American households have a firearm in the household. There are approximately 120 firearms in private hands for every American. They're disproportionately in some hands and less in others. But that's the reality of the world that we live in. So there is no way that we are getting rid of all guns or getting to a zero death rate. So that's kind of part one. Part two is, given kind of all the firearms that are out there and the variety of state and local cultures as well as laws, there are also a lot of other parts of how we stop firearm injury. We could pass a law that says we're going to get rid of all of X category of gun tomorrow. The reality is, again, we have about 440 million firearms in private hands. That is not going to be sufficient. We know that there's also ghost guns out there. With all the firearms that are in the world, we also need to talk about those environmental, educational, and enforcement solutions, as well as economic motivators for reducing the chance of a firearm injury. That applies to firearm suicide, and I'm sure you're going to talk more about the details of what you do within Walk the Talk. All of the ways in which you create partnerships, just like we do for every health problem, to help reduce the risk of harm. That's true for the work that you do in Chicago. We think about a lot of those environmental and community level solutions that reduce the drivers that lead someone to pick up a gun to solve a problem. And at the end of the day, it's about reducing the main driver of firearm ownership in this country, which is fear. People own firearms partly for hunting and shooting and sport, but increasingly people own firearms to protect themselves and their family. And so if we want to reduce the chance of harm from a firearm, we also have to talk about reducing that underlying fear that has driven 84% of us, American adults, according to a recent KFF poll, to change something about the way that we live our life.
Now, Franklin, you've made the point that legislation is in fact important to curb gun violence, but not necessarily in the way that many people might think. What did you mean by that?
Yeah, no, thank you. So legislation is important, but we need to reframe what we're having our legislators focus on, right? And I am inspired by movements lately that have focused on not just simply looking at policing as a response, right? It's very important that you look at the resources that are available from the community, those individuals that had carried before but desisted, those individuals that have caused harm in their community but actually found a way out, and they can connect because they've been impacted by the adverse experiences that comes along with being a victim of trauma, what comes along with harming someone with trauma, that comes along with wanting justice in addition to fear, justice for something that's happened to them. So those individuals understanding, described as credible messengers, they have walked the walk, they have made the change that they're asking you to make. And we're very fortunate that thanks to that work that's been happening over the past 20 years, that we're actually beginning to see individuals who were causing harm to their communities elevate themselves not only to directing approaches, community-based approaches in their community in which they live, in which they possess the social ties. Again, the things that make neighborhoods safe are unilateral, right? It's how well we can come together to support each other, to support belief systems. But when there are processes and steps that disrupt that, how do we reestablish that? And so through that, those individuals that have had caused harm now have desisted from that, are not only leading that work, but now they're in legislative spaces. In Chicago alone, we have Chris Patterson, who is the Assistant Secretary for Firearm Injury for the state of Illinois. Chris Patterson was a street outreach credible messenger before that, but before that, he was previously incarcerated, right? We have Eddie Bocanegra that's actually in the Department of Justice. He was someone that caused harm in his community before, then desisted, led this community-based approach, and is now helping legislators and policymakers understand we need to reframe where we think our solutions are. And so that legislation is also important because it addresses the root causes, right? It's what are we doing to actually understand the impact that trauma has, that the trauma that's passed down from generation to generation. What are we doing for the inequitable policies and practices that I shared that my grandparents were experienced, in particular, redlining, right? Contract selling. My grandfather worked hard. He worked at the steel mill. He thought he was buying a mortgage, but there was a predatory contract scandal in Chicago that currently contributes to a $3 to $4 billion wealth gap that impacted 80% of African Americans that thought they were buying homes as a means to develop equity to gain financial freedom. So having individuals understand, legislators understand, we need to invest in housing. We need to invest in community-based approaches. We need to invest in hospitals, recognizing, I currently direct a hospital-based violence intervention program, recognizing that hospitals also serve as this golden hour, this space where a survivor of violence now is rethinking their trajectory and how we can work with them around crisis intervention and case management to help them towards their patient-centered goals. So rethinking about how we distribute that, funding issues that are tied to root causes such as housing insecurity, food insecurity, employment opportunities, in addition to making sure that there's equitable distribution of funding for community-based approaches, is what I would like to continue to see happening from our legislators, and very proud for the first time in United States history in 2001, there was a significant distribution of funding focusing explicitly on community violence interventions. That has me hopeful. We still have a ways to go to address those root cause issues that, again, are tied to policies and practices that impacted people like my grandparents, that passes down from generation to generation.
Michael, you told me that people who don't own guns often make wrong assumptions about people who do own guns. Why does this make it hard to find common ground on measures to curb gun violence, and why is language so important here?
I think people look at gun violence and they focus on what triggers them, what they're passionate about, right? So you look at, say, the south side of Chicago, and you look at everybody that owns guns there, and you have people that don't want to rely on the police to protect them. They have to be responsible for their own security. You also have people who are out there just trying to live, and it's a lifestyle that they've been brought up in, that someone like me can't go in there and just be like, put the guns down. They'll be like, seriously? So each one of those people deserves the right to knowledge about responsible gun ownership. They also deserve the right to legislation that might help them. So, like, I'll give you an example. When I first started Walk Talk America, I was like, I am absolutely not getting involved in legislation at all. And I didn't think about it. What if there was positive legislation from the standpoint of someone from the gun community? And I got approached a couple of people that are like, what if we did rebates for people who bought a gun and they also wanted to buy a safe, whether it's a biometric safe or safe? And I thought, yeah, like, guns are expensive. I don't know how many of you know, but like, you're not getting out of a gun shop without spending at least $200 on the gun, minimum, right? And you could go up to $1,500, $2,000. So the single mother who's just trying to protect herself, she's going in there, she's already got to drop a couple $100. You think she's thinking about a safe that might cost $150 more? Some people can't afford that. So I love legislation that literally encourages and helps people from underprivileged, underserved communities to actually be able to afford, while they're going through that legal process, to be able to buy the things that come with guns. Now, having said that, too, I also think we need to educate people that are out there on the hustle in the street, because we don't need unnecessary gun charges on people. We also need them to understand the importance of responsible gun safety. Just because you're doing something illegal doesn't mean you can't still be a responsible gun owner. And that's really what we focus on.
Well, and you told me, use the word responsibility, not safety.
Yeah, responsibility I love, because most gun owners can really get with that. One of the biggest issues I saw when we talked about safety, right? Like, it's very hard for people that are part of the Second Amendment, the 2A community, to accept people looking at them and saying, well, be safe. Gun owners tend to think that they're the safest people on the planet. And we know that's not true necessarily, right? But we're also the type of people that watch movies and we look for these little individual events where we could call them out. Like, he just muzzle flashed that whole group of people, or he has no trigger discipline, right? So people think of safety that way. I like to call it responsibility, because responsibility is something that everyone can understand. I don't need people to shut down when people are trying to pass them good information.
Now, Michael is very focused on the suicide prevention side of this problem. Megan, can you give us a little bit of context here? What is the link between mental health and gun violence? And are people with mental illness more likely to commit acts of gun violence? What kinds of mental illness would actually predict gun violence?
I'm going to answer that, but I just want to comment on one thing that Mike just said quickly. I just want to put a point for those in the room who are not firearm owners around that safer storage comment, around the importance of gun safes. And this goes into the mental health part. If we look at, I'm sure that many of you are aware that gun violence is now the leading cause of death for American children, largely due to firearm homicide among young black children, but also due to firearm suicide, and a very small percentage of it is mass shootings. When you look at kids who kill themselves or kill others, the vast majority of people who do so with a family member's gun. There are studies showing that the vast majority of kids who live in a house with a gun say that they can access it within 3 minutes. Households with a gun are no more likely to store their firearm safely, regardless of whether they have kids or not. And so this emphasis on harm reduction, on making sure that folks who do have a firearm in their house have it stored as safely as possible, would have a tremendous impact. It is RAND, many academic institutions have said that that one intervention is perhaps the thing that we can do that would have the greatest impact on firearm deaths in this country. There are legislative aspects to it, but there are huge non-legislative aspects. And so I just want to provide a little more context to your talk about kind of that provision of safes and just how unbelievably important it is. Now going on to the mental health question. This is the topic, right? This is the talking point. Oh, it's just mental illness. And to your point about mass shootings, everyone thinks you have to be crazy to go and commit a mass shooting. Where mental illness is deeply part of the firearm injury epidemic in this country is around firearm suicide. Because at the point when someone decides to take their own life and chooses to use a firearm, there is hopelessness, despair, depression, often post-traumatic stress, as well as often economic or personal stressors, whether you've gotten fired from a job, broken up with a partner, or had facing some sort of a legal stressor. That, combined with easy access to a firearm in a moment of tremendous mental distress, is responsible for a huge portion of firearm deaths in this country. On average, over the last 10 years, 60% of gun deaths in this country have been firearm suicides. Where mental illness is not related to firearm injury in this country is around mass shootings. Studies have shown that the proportion of people who commit mass shootings have only a slightly higher rate of mental illness than the rest of the American population. What they do have is a history of prior violence, a history, particularly domestic violence, a history of a personal crisis, often a history of substance use, and a very clear history of making threats. And so they may have personality disorders, which many of us in the medical community will say, well, that's a form of mental illness according to the DSM, but that's not the way that most of us think of mental illness. And blaming mental illness for those mass shootings is it's a false equivalency. The last part where mental illness is involved with firearm injury in this country is around the ripple effect. So I mentioned that KFF survey, around 84% of us have changed something about our lives due to fear of firearm injury. I have an almost 15-year-old daughter. She tells me that she wears only sneakers to school events just in case she has to run. Over 50% of us have personally either been involved in a shooting or had a family member who has either been shot or at the place of a shooting or been killed. And that rate goes up in Black and brown communities. The ripple effect of exposure to firearm injury on our country, the fear which then drives the desire for self-protection, because you think nobody else is going to protect you other than yourself, is tremendous. And so when I talk about the link between mental illness and firearm injury, that post-firearm injury or post-community exposure to firearm injury is where I think we really need to spend our attention and our resources. We see it in the urban communities, and I hope you'll get a chance to talk about some of the stuff you guys do at BHC Collaborative. We see it in rural communities where rural suicide rates are through the roof, largely due to firearm injury, and we see it in probably many of us sitting in this room.
Michael, you told me you actually were not supportive of red flag laws, which sort of surprised me. So these are also known as extreme risk protection orders or gun violence protection orders. Why don't you think these are effective in reducing gun violence?
So let me tackle that, but let me first say that one of the coolest things that you ever said, I don't know if it was yours, but even when you were talking about mass shootings one time, and something you said it's suicide turned outwards. And that I use that all the time. I credit you. But I thought that was
Thank you,
amazing.
Mike.
Yeah. So you got to understand, everybody in this audience, I work in a world that is completely different from the average person you probably know. I'm from the gun industry. So the people that I come across at the SHOT Show, which is our largest show in the United States for guns, or the NRA show, they are all staunch 2A supporters. Okay, so don't hear Mike's against ERPOs, because I'm sure there are times when people do not need access to their guns. We could all agree on that. But what I'm telling you is the amount of people that come to me and say, I will not go get help because my state has a red flag law and I don't want to lose my gun rights. It's insane. So I walk in a different world. That being said, we don't need to create barriers to entry for people with firearms to go get help because we want it to feel good. Now, I am okay with every single one of you disagreeing with me. And I'm actually okay with you saying I hate guns because you just don't want to see people die. And that's an island we can meet on. But you got to understand where I'm coming from, which I will always appreciate where you come from. But that's why ERPOs are dangerous to me, because I live in a world where people won't get help.
Can I provide a little bit of a counterpoint? So my argument here would be that we have not educated people adequately around ERPOs
100%.
and when they are used. So these ERPOs or red flag laws have shown to be effective in decreasing suicide, and there's a bunch of case studies, there's a bunch of reports of times where they've averted mass shootings, where someone kind of said, see something, say something. To me, it's the education around the fact that those are a last resort. I'll tell you, I take care of people who are suicidal in my emergency department all the time. We have a red flag law in my state. I have never once tried to get well, that's not true. I've once tried to get law enforcement to enforce it, but that was around a mass shooting fear. In the suicide conversations, I have a conversation with my patient or with their family member and say, I'm willing to let you go home, but I need your wife or your partner to take the firearm, lock it up, and have you not know where the key is until we get you through this crisis. And so I think part of this is also an education around, if you are willing to step up and you are in a moment of crisis, we are all here for you and ready to reduce harm. Those are a last resort. And it's a very short hold in the vast majority of states. When that red flag law gets activated, you have to go through a judicial process. The firearms are taken away for only a very short period of time through the red flag law. It is not a permanent confiscation or ban. And so to me, this is like an amazing opportunity for us to do better for the communities, that we have that stopgap for those really bad, dangerous situations.
Right, and I completely agree with you there, but I will tell you this.
I know, yeah.
I want to make sure we get to some of the other topics, but I think it's important to demonstrate that there is some disagreement, and yes, there's data to support that these do work, and still there's disagreement.
Megan and I have a great relationship. We can disagree about anything, but absolutely. Are there times when people should not be with their firearm? Absolutely, right? Both sides, the anti-gun, the gun neutral, or all three sides, the gun neutral and the pro-gun people, and we took a situation like Parkland, everybody agreed that guy should not have had access to firearms at that moment. I don't think that's the issue. I think what we need to really focus on is the path of restoration to get your guns back if you are in those situations. And this is a much bigger conversation. We don't have enough time. I'm looking at the thing right there. But
Celine's going to kill us.
Yeah,
let's move
to the next question, if you don't mind. Franklin.
Yes.
What would it take to improve mental health services in such a way that it would actually have an impact on gun violence?
Yes. So first of all, I'm appreciative of having you on the panel, because we're not going to really get anywhere if we are all one band, one sound, because we know that's not how our nation's represented, right? And so it's actually getting engaged in these conversations where there are different perspectives that I really appreciate, right? It's frustrating, but I appreciate it. With that being said, what we have found and work that we've done on the south side of Chicago is that when you say mental health, and I'm going to quote like leader of work, before I started this hospital-based work, I was supporting community-based work. His name is Pastor Chris Harris. I just love all of you to meet him. But Pastor Chris Harris recognized as a pastor that people were coming to him around their issues connected to exposure, vicarious trauma, which has, there's been research that shows that just hearing a gunshot in the community actually impacts academic achievement and test scores, right? Not to mention direct trauma, that people would go to pastors, their faith leaders, for mental health support. And so it was in that space he said, well, what I'm recognizing that when it comes to mental health, first of all, I don't know what it is. And then if you tell me what it is, I don't know if I could trust you, because there have been so many systems of institutional failures, right? Particularly for the population that I'm describing, but for many of our individuals across the nation, our diverse nation, that have experienced adverse childhood experiences, right? And so I don't know if I could trust. Trust is an issue. And then if I could trust you, I don't know if I could afford it. And so from this approach, it was, what way can we, under licensed clinical social workers and clinical psychologists, be trained as paraprofessionals as the front line of people who have these relationships? Again, I described community violence intervention work that involved individuals that actually at some point had caused harm. I want to uplift, they have been harmed themselves. We know hurt people. So, but how can we take a similar model? We're credible because we're trusted, and be trained to help build that capacity. And so through a system called Bronzeville Communities That Care, the prevention planning system, it was actually developed by researchers out in University of Washington, trained around how we could get people together around understanding prevention science, understanding how risk and protective factors can get us to come together. But how can we also, with that in mind, train individuals to be that front line? And so that is very important. It is about who's the ambassador. Relationships matter, right? It's who I can trust because you've been through this experience, you lived in this community. If I can trust you, I can talk to you. We need to expand an opportunity to do that. I am going to consistently say that we need to have an infrastructure for prevention and prevention. What that means is that we need to have line items in our federal level, our state level, county, city level, the line items for budget that are dedicated for prevention and intervention services. Mental health should be a part of that. There have been a lot of structural impacts that have really degraded what keeps communities safe, particularly in areas that have been durably high in terms of exposure to violence on the south and west side communities of Chicago. That includes the massive housing destruction, school closing, largest school closing and housing destruction in United States history, but also 50% in 2013, Chicago shut down 50% of its mental health clinics. We need to reverse that, but we also need to think about who's the messenger. Just as you mentioned, you're not going to go into the community and say, hey, put that gun down, but it's the messenger and the relationship that does matter. So taking the resources that we have, training, like at the University of Chicago, training community leaders to be those trauma ambassadors has been an approach that I find that has been statistically shown to reduce aggravated assaults in that Bronzeville community and robberies, and nearly significant in terms of homicides and shootings. We need to continue to invest in that approach.
Megan, what would it take to improve mental health services to actually reduce gun violence?
So I think the first thing that we actually need is not mental health services to reduce gun violence. Again, we need safer storage, we need space and time between people who want to hurt themselves or others and a firearm. Sometimes that's around things like not allowing that person to purchase a firearm in the first place if they have a history of violence perpetration, if they have a history of substance use, et cetera. The second thing is around training the communities where firearms are common, and this is the work that you do, to identify those risk factors and put that space and time between a person who already owns a firearm and that gun so they cannot hurt themselves or someone else. The third part around where mental health services will make a difference is, again, around that post-trauma treatment to reduce the fear, the post-traumatic stress, the anxiety that so many of us experience that often drives us to go purchase a gun with insufficient training and safety protocols. there are actually studies showing that increasing the number of psychiatrists in an area only would decrease the number of gun suicides by about 10%. So it is about access to treatment for sure, but it's also, again, about putting that space and time in place and talking about the historical trauma, the environmental change that makes a difference. One more thing that I'm going to say. If we're going to talk about mental health, one of the biggest drivers of mental health, as all of us here at Aspen right now know, is exposure to green space. Nature has been shown over and over again to be a tremendous correlate of mental health, performance, et cetera. There have also been studies, including in Detroit, Philadelphia, there are some new ones going on in Chicago, showing that when you put gardens into communities that have experienced historical redlining and economic disempowerment, in the neighborhood, the block right around where a garden is put in, compared to a community where that garden is not put in, you see lower rates of stress and depression. You also see lower rates of gunshots and violence. So if we're talking about mental health, I think we have to think, yes, we need more mental health services, 100% in that post-trauma period in particular, kids that have experienced adverse childhood experiences, but we also have to think on a broader level about what actual facilitation of mental health looks like in this country.
Yeah.
Michael, I mean, this is really where you're focused. Do you have anything to add on that?
Yeah, absolutely. I mean, she's 100% right. What I'm here, put on this earth to do at this moment is to get the gun industry off their ass and literally provide resources and outlets for people to get better mental health care without fear of consequence and demystify the counseling process. So we can attack it at all angles. Like, that's one thing that we could agree on, that, hey, when you buy a Ruger, right, which is one of our programs, you open up the box, and there's a card in there from Walk the Talk America that says, take a free and anonymous mental health screening, because you're a gun owner now, and this is important. We could all agree that's a good idea. Like, no one's going to sit there and say, that's a bad idea to have free and anonymous mental health screenings in the boxes of guns on the side of ammo boxes. Because what we're trying to do, once again, is go back to, let's work upstream. Let's try to catch people early. Let's try to make them feel like it's okay to go get help. Let's demystify things like the red flag process, right? Like, everybody talks about these things as if they're some giant boogeyman, but most of them are just listening to an echo chamber. So it's important to educate people. So I'm totally for what you guys are saying.
Franklin, your program in Chicago is still relatively new. So
Yes.
As we were discussing, most of the measures you have are process measures rather than outcome measures, but other parts of the country have used similar approaches. I think one great case study is Oakland. We talked a bit about this. In Oakland, a partnership among community members, social service providers, and law enforcement reduced their gun shooting homicides by half. And I don't know about you, Megan, but I don't know anything else in gun violence that's reduced things by half in a 6-year period. Your program has a lot of overlap in its approach. Why aren't we seeing more programs like yours, like the one in Oakland, being rolled out when they work so well?
So first of all, Oakland and I think Milwaukee are one of the original hospital-based violence intervention programs. I'm encouraged that there are approximately 40 what we describe as HVIPs, hospital violence intervention programs, and there are also the Health Alliance of Violence Intervention are currently involved in creating opportunities for more members, where they call them hospital-based violence intervention, kind of sustaining or entry-level programs. One thing I would like to highlight, first of all, like the successes in Oakland are outstanding. The volumes that we see in Chicago are, they're nearly like 4 or 5 times higher, right? I am again encouraged that, first of all, there's no one singular approach, right? And so we can't go all in, cards in, saying, hey, we're just going to invest in a hospital-based approach. I think it's going to take a coordinated and comprehensive approach that involves community-based work, that it involves researchers really understanding what works, what doesn't work, that it involves equitable, collaborative policing, that are working with community partners that have existing relationships where they can engage individuals with humanity and not as suspects. We have that coordinated approach. In addition to hospital-based approach, is going to be incredibly important. I am encouraged by the growth of it and the organization around that and how we are all communicating with each other. But we need to keep in mind, and particularly in my context, the volume levels that we see. Our program has been running for a little bit over 5 years, and we have seen over 8,000 we have engaged 8,000 members in our trauma center, which is approximately like 1,800 a month. I mean, 1,800 a year, right? So it's complicated, but I am encouraged by the direction.
Why is it important to be evaluating these gun violence intervention programs? I'd like to start with Franklin and then Megan.
Yes.
And
So again, I'm going to quote Pastor Harris. He said something that I love, and I love to talk about it when it comes to building capacity for community-based organizations. And it's this simple: dollars follow data, money follows metric, and before you can expand, you must evaluate, right? And so in order to actually understand what works and to actually build it out so you can get it to scale, that last public health approach, you really need to understand what works and what doesn't work. Unfortunately, there have been programs in the past where millions of dollars have been spent in programs, and they've actually shown to cause more harm. I think, in our conversation highlighted DARE as one example of that. Mm-hmm. There's been a shift since then, so I'm happy about that. But if I'm talking about developing an infrastructure for prevention and intervention, we need to know what works and what doesn't work. I think from a bipartisan approach, I'm encouraged that our nation from both sides are saying that, you know what, incarceration has not worked. We've seen a 600% increase in incarceration since the 70s, and the violent crime rates go up and down, right? And so making sure that we understand what works and what doesn't, evaluation is critical towards those means.
Megan?
Exactly what he just said. I'm going to add on one more part, though, which is actually in gathering data and in sharing it back with communities, you empower communities. This is true for violence reduction programs. This is true for suicide reduction programs. This is true for domestic violence, for unintentional shootings, and for mass shootings. In the process of evaluating and collating that data, you not only show that you're spending money in a way that's worthwhile, that's helping rather than harming the community, in a way that allows you to improve on the programming, but you also, by sharing that data back to the community, help to create agency there and empower the community itself to step up and see the importance of taking on issues and to identify new and innovative ways of stepping in and stepping up. To me, that's one of the greatest powers of data. I'll say the city of Chicago has done a really nice job with creating some violence prevention dashboards. The state of New Mexico has done an excellent job around gathering and preventing data around firearm suicide and firearm domestic violence, which PS is the leading cause of homicide death for women in the United States. So those are in New Mexico, it's suicide and domestic violence death that is more common, and they've done a great job of sharing that data out with gun shop owners, with local communities. So the evaluation also has an intervention component.
Yeah, and if I could quickly add just to your point about what's happening in Chicago. So maybe 10, 15 years ago, and I've been in this field for about 23 years, I remember when I was encouraged by this community-based, these credible messengers, this community-based violence intervention work, but the police officers were like, oh no, you're just trying to use this as an opportunity to expand your network and to do more crime. That is no longer the case. In fact, twice a month, there are coordinated calls that look at data, look at those dashboards, to look at areas together, police and street outreach workers, to say, okay, these are the areas that we describe as being in the red. These are areas that I want to hear about what's happening on the policing side. Hey, I need your support to what they describe. Get the guys that are at odds with each other to be on defense, right? A violence reduction approach, right? So not necessarily say, hey, I'm going to tell you to stop carrying, but don't go in their community. Just be on defense. And coordinating that approach has actually shown to reduce hot spots of violence. At the same time, what I really appreciate is that they credit each other around their humanity, right? The areas that are in the green, right? Areas where we're used to there being this particular street or a couple of blocks have been hot spots. You know what, you guys are doing a great job. And on the police side, we appreciated that you came to this community event to demystify the harm that they understand has happened to their family, their community, that were at the hands of the police, to help us reframe that. So that all happens around data, and it's that is important to continue sustaining that approach.
Michael, how are norms changing now around guns in communities that have high rates of suicide or homicide, for that matter?
Well, first of all, I'm going to try to get myself thrown off the panel. I'm going to say, don't let data get in the way of saving a life. Like, honestly.
Fair.
Some things can be anecdotal. And sometimes, like, if you try to pry for data, it is a barrier to entry. But I do agree with you overall. If we could track things, these are great. But, okay, so you asked how
norms are changing, especially in communities that do have high rates of homicide or suicide. How are norms around guns changing?
Well, I think, for me, I think that starts with my community, which is the 2A Second Amendment community. 5 years ago, we wouldn't have talked about suicide prevention or better mental health just because we were afraid that it'd be used against us. And many times it could be, right? But getting the gun community involved, and that goes down from the manufacturers to the firearms trainers to the gun store owners, to where they're part of the conversation, and this becomes part of the curriculum, this becomes part of everything we preach, I think you'll see a huge impact. Now, nothing I do is sexy. Sexy is when you can pander or say things and get it followers within 4 years. This is a cultural shift that I'm going for. I don't bow to anybody. Unfortunately, I'm not getting money from these big conglomerates. I will take money from you if you are willing. I'm not too proud to beg. But the work that I'm doing is, I think you're going to see in 8 to 10 years, sort of like when you brought up seatbelts, right? Like, my kids get in the car and they put a seatbelt on, and there's no discussion. And I don't even remember really teaching them about that. So for me, cultures, and we have 2 cultures, 3, I'll put 3 out there, right? We have the African American community, minority community, underprivileged, underserved communities out there buying guns. Let's just take, okay, so women. Women are some of the fastest rising gun owners in the United States. But let's just go a step further. Let's make it a little political. Like, we have a lot of Democratic liberal gun owners now, right? We saw that happened a few years ago. So this is an opportunity. This is an opportunity to do it right. We have all these new people coming into the gun industry that don't necessarily have the same beliefs when it comes to all the things that the gun industry is accused of being. And we can literally make it right. We can put out the education, the information, and start gun owners on the right foot. And it doesn't have to be this pry from the cold dead hands, like, I won't talk to you because maybe we disagree on firearms. Like, this is a place where we can meet in the middle. So that's where I'm seeing a shift.
Franklin, what are you seeing with the communities that you work with? Are their norms changing?
So again, it goes back to the messenger, right? That is the driving force for community violence intervention work, is making sure that there are people that understand the life that you're living, the structural constraints, the historical trauma, and the interpersonal trauma, the fact that you want justice. You're afraid because you haven't had justice. That justice has not happened structurally, whether it's related to economics, whether it's related to housing, whether it's related to education. And so it is the messenger that's going to matter, and it is how we can coordinate and collaborate to support that. In our hospital-based work, we follow a similar model. We have individuals that they come from the same communities, right? Some of them have been violently injured themselves. They understand the path towards recovery. And so when you're talking about norms about how you would handle conflict, understanding that conflict is natural, but it's how you handle it that's important. Understanding that you need to also be flexible. People have been impacted by being violently injured. They're going through different states of emotions and mental health states, whether it's hyperarousal, hypervigilance. I'm carrying because I don't feel safe, and helping them unpack that trauma, which I think is why mental health services is incredibly important, because of that overall exposure and how you can have credible individuals help them with reframing norms on how you respond to that. But, and again, I'm super grateful to be in this space. I'm also frustrated, because I think that the conversations we're having, I don't hear those conversations happening in the community, right? I hear that they need justice, they need safe housing. It doesn't matter if, if they're in our emergency room, they get discharged back to a location where they were harmed, right? If we don't have an opportunity, they're just re-triggered and they're going through this cycle again. So the messenger is going to be incredibly important. That's the approach that is happening through the hospital. That's the approach that's happening in the community. And I think that when you really talk about changing norms, that's important. I'm very proud of the space that we have through our city government leadership that is actually tying to understand what we're seeing regarding violence and trauma is the tip of the iceberg. But beneath that, beneath the waters, are issues that are tied to cultural violence and structural violence that have roots in race and racism that we really need to acknowledge and unpack if we're actually trying to get true healing. It's not simply about, how we store violence. We need real justice.
Yeah.
Megan, can we change the norms around guns in this country through cultural rather than legislative approaches? And if so, what does that look like?
Absolutely. I'm going to say that there's an element to both. I'm also going to recognize that we are in a weird legislative moment right now after the Bruin Supreme Court decision of last year, which is in the process of dismantling many of the existing legislation that we have around firearm injury and firearm ownership. There is a huge space around normative change. People don't believe me when I say that we can and will and are changing norms around why you purchase a firearm, how you keep your home safe if you have a firearm in it, and how we reduce these patterns of injury. The reasons why I believe we can do it, I'm going to give a few examples. The first is, when I started doing this work, going back about 15 years, there was this thing called the Dickey Amendment, which many of you have heard of, passed in 1996 in response to researchers like me, that basically took all the money away from the CDC that they had been spending on firearm injury prevention. From the time that the Dickey Amendment was passed in 1996 up until 2020, 24 years, there were 0 appropriations from the federal government for firearm injury prevention or firearm injury prevention research. NIJ, the Department of Justice, was spending a little bit kind of off on the side surreptitiously, but it was not a thing. And it was blocked to the point that I was told by many of my mentors when I started doing this work, don't talk about gun violence as a health problem. You will never progress in your career. You will be fired from your job. This is a political third rail. We changed that. We changed that collectively through partnerships between firearm owners and firearm non-owners, physicians, nurses, social workers, victims, survivors, law enforcement, creating a story about why firearm injury is a health problem and why we can apply the same techniques that we've applied to car crashes to firearm injury. We got appropriations underneath President Trump. So under a Republican administration, a Republican Secretary of HHS was the first to make funding available for this issue in 24 years. That, to me, is an example of cultural and normative shift that would never have been possible. The prior Democratic Secretary of HHS was unable to do that due to cultural norms. Another example is the partnerships that I have with a number of folks, including 4-H shooting sports, a number of firearm owning communities, around talking about the potential harm of firearms in the home. My position as a physician is to try to reduce the risk of harm given someone's existing life choices. I want you to put a seatbelt on rather than not. I want you to not drink and drive. If you are going to drink, have one drink, don't have a bunch. If you are overweight, let me talk to you about how to reduce weight in a way that doesn't provide judgment but provides clear pathways to try to reduce that risk. Ditto for firearms. Let's talk about how we're going to reduce the risk of you or someone in your home getting either unintentionally or intentionally shot or shooting someone else. I am seeing progress in that in the healthcare community. Many of us are taking on screening and interventions. We have CEOs of health systems stepping up to talk about why this is a health problem in a way they never would have. And we're seeing partnerships with the firearm owning communities that this is not a one-side issue, because again, with 40% of Americans as firearm owners, we are not going to fix this if we try to make it a partnership, the action of one side versus the other. I have seen huge normative shift in that space. I see promising signs around more, but it really does take all of us. I know that we're getting towards the end, so I'm going to kind of say just a couple of things. The first is, if you take nothing else away from this, it is that firearm injury is preventable. The second is that every one of us can do something about it. If you have a firearm in the home, make sure it is stored as safely as possible. If you have friends or family members with firearms, know those risk factors, depression, domestic violence, et cetera, and how to talk to them about safer storage. And then the third part is to know the facts and share your stories and be willing to be part of unlikely coalitions within your community to fight for justice and for change, within your state, within your school system. That's actually how cultural change and normative change happens. And I have seen proof of it every day.
So I'm going to just do one rapid fire round with these guys, and then I think we have time for maybe one or two questions from the audience. As you get ready with your questions, if you could target them at one of the panelists. If there's one thing you could do today around gun violence, or what would you recommend people in the room do on gun violence as they leave Aspen?
For me, I would say push for prevention and intervention to be a part of the infrastructure of your municipal government budgets.
Megan?
Safer storage.
And Michael?
I would want you to approach me and be like, I don't get this, so I need you to make me understand it. Okay? There's a lot of things about the gun community, and we've done a horrible job of conveying this information. So I welcome, even if, like I said, you want to tell me you hate guns, but you're still being open to learn. Keep an open mind.
All right, question here in the middle. Gentleman with the glasses.
Thank you. I don't know where to start.
This is a tough issue.
It is. I just wanted to ask the gentleman, Michael, what other countries in the world have the level of gun violence equal to United States?
Well, I would say, how are we defining gun violence? And that's the
Gun
problem.
violence, I'll tell you, I'll define it for you. Mass shooting every other day, suicide tremendously. Everyone, I'm a psychiatrist for 50 years, practice in this country. And only one of my patients killed his wife and himself, and everybody else that I have seen, from paranoid to schizophrenic, from bipolar, never, ever have done that. Okay, so don't try to pin it to mental health. It's not mental health. Let me tell you something. Second Amendment is one of the most known amendment in all the 14s. And if you ask 9 out of 10 people, don't know the last 12 amendments, okay? This is like cigarettes. Guns are like cigarettes. Once the attorneys got their hands on top of it.
I'm sorry, if I could just interrupt. Is there a question that you'd like to ask Michael?
Well, just give me 1 more minute, okay? Because this is important. Because I need to also mention, and I want to ask Michael again. Basically, okay, I lost my thought. All right, I just want to tell you, Florida is the 3rd largest, most populated state in the United States. The governor and the Republican House, they passed this law that you can carry a gun without training, without any question asked, and you can shoot anybody who makes you uncomfortable. It doesn't need to be threatened. Just somebody makes you uncomfortable, pull your gun and shoot them, okay? This is what is behind this Second Amendment. We need to get the lawyers. I tell you, all of you, everything you said is correct. We need to get the lawyers to, every time that there is a mass shooting, they sue the manufacturer. And I'll tell you, within 10, 15 years, there will be no gun violence here.
Just one more question. This woman here in the front, red hair. Thanks.
Hi. You briefly touched on this, Megan, but we've heard a lot about homicides, mass shootings, suicides, and the groups they impact. But I haven't really heard much about intimate partner violence. Are there any unique solutions other than the ones you've mentioned? Because obviously it's such a complex, multifaceted issue other than, keeping people with mental health issues, safe from themselves essentially, or preventing homicides.
Thank you.
Other homicides, I mean.
So two parts. One is, again, domestic violence, homicide, which is almost always with a firearm, is the leading cause of homicide of women in this country. Black women are much more likely to be killed through firearm intimate partner homicide than white women, so there is a huge racial disparity as well in this. Also, a history of domestic violence is one of the greatest predictors of being an eventual mass shooter. So there are two parts to domestic violence. One is protecting the victims in the moment. The other is protecting the rest of the community afterwards. Thanks to recent expansions of our national legislation, although again, this is currently under challenge thanks to a Fifth Circuit decision that is challenging this entire kind of group of legislation. Folks who have been convicted of a domestic violence offense are supposed to have any firearms in the house taken away. This law is very variably enforced. In my current home state of Rhode Island, we've actually done studies showing that a significant proportion of family court judges do not ask about access to firearms in the home, and the firearms don't actually get repossessed after that conviction for a domestic violence, for perpetrating domestic violence. There's also another side of it, which is considering that around kind of prior convictions for violence are disqualifiers for purchasing a firearm. Many of the mass shootings that have been convicted have been due to lack of reporting of that into the federal background check system. So there's another side to that enforcement as well, which is making sure that the rest of us stay safe. So I appreciate you asking that question. Domestic violence itself is a tremendously complex issue, which goes far further than access to firearms. But if a perpetrator has access to a firearm, that victim's risk of death goes up almost exponentially. And so that removal of the firearm in that moment of danger is absolutely essential. Thank you for asking.
Well, I just want to thank our panelists for a really stimulating conversation. Franklin, Megan, Michael. And thank you all for your questions, for your interest, and for being here.
Thank you.
Thank you.
Appreciate you.